You are watching the DocTalk show.
Okay, so we're still talking about foreign bodies lodged in the nose and throat, and my specialists here are going to tell us how you can manage the situation at home and how it can be managed in the hospital setting. I'll turn to Dr. Etima. What advice can you give to someone who, let's say their child or someone at home has a foreign body lodged in their nose?
So for the foreign
treatment can they
bodies,
give? Yes.
for a foreign body in the nose, especially if it's a child who is of age, who can understand instruction, you hold one side of the nose, one nostril, and then you ask the child to blow.
To blow.
Okay? To blow their nose. So that pressure of blowing the nose can actually help to pop out the foreign body.
Okay.
If it's something that you can reach with your finger, or if the foreign body is not pushed too posterior or to the back, then you can attempt to remove it with your fingers. But we discourage the use of anything sharp. Sometimes people try to use tweezers. Sometimes people try to insert things into the nose to try and pop out foreign bodies in the nose. Try not to do that, especially at home.
Okay.
This is for foreign bodies that are stuck within the nose.
So how about throat? If
So for the throat,
eating and then they get choked on a piece of meat.
so if you're eating and you get choked on a piece of meat, there is a maneuver called the Helmish maneuver, where you wrap your arms over the, so you're standing behind the person who has had or ingested this foreign body, who has swallowed the foreign body, or if it has gone into the airway. So you stand behind them, wrap your hands over their abdomen or their stomach, and you push. So you're pushing inwards towards yourself in an attempt to increase pressure that will help to pop out the foreign body.
So the person who is choking has to stand up, and
Yes,
then you
stand up.
the person going to attempt
do the
that
maneuver, you
has
should
to stand
standing up, but at the back.
At the back.
has to stand behind.
Yes.
Yes. Then you kind of hold your hands
Yes.
and place.
Place them over the person's abdomen, like their stomach, and then you push inwards. Yeah, you push inwards.
What does that do?
It increases the pressure within the stomach, and it can help to pop out whatever is in either the breathing system or the food system.
Okay.
This is for adults.
That's for adults.
Yes. If it's a child, we advise that you hold them, usually with the head on the lower part. Okay? So their head should be lower than the rest of their body.
Down, feet up.
Yes, hold them head down.
Can rest on the mother's lap.
If they are that small.
If they are that small, yes. And then you tap the child's back. Okay? It should also be a bit of a forceful tap, because you're backing on the pressure that you're creating to help pop out this foreign body.
Gravity,
Yes, and also on gravity, because their head is lower than the rest of the body. Again, we emphasize try not to insert things into the nose, into the mouth, in an attempt to remove the foreign body, because you may actually end up making problems. The issue was
And the situation. Okay. Oh, thank you, Dr. Itima. So these are maneuvers you can do at home.
Yes.
In attempting to remove the foreign body.
Yes.
If it refuses, it may warrant going to the hospital immediately. So, Dr. Omar, what would happen to the patient who has a foreign body that has refused to dislodge?
All right. So, like we were saying, we need to know the foreign body and which risk we are opposed to. The risk that we are about to encounter. Okay. And where do you expect this foreign body to be exactly? Okay, so that helps us in the management while in a hospital setting. Okay, now for foreign bodies in the nasal cavity, okay, like we said, all the things and how we would know, and the basic thing is to hold this child still. Okay, whether you use what or what, there are basic maneuvers or ways of holding a child, as you may see. Okay. Those maneuvers or those positions help us stabilize the child And when we use blunt instruments, okay,
Not sharp.
not sharp,
not
because
sharp.
every time you use sharp in a fighting child,
You cause more
cause
harm
more
than
problems.
good.
The trauma
Yes.
that we
Push
talked
it
about,
when
the
you-
bleeding, you may push it farther away. If it's in the nose, it ends up in the airway, then you double the problem already, or multiply it if you like. So holding the child still and pulling out the foreign body with a medic under good illumination or light
Yes.
is very important. And if we fail, sometimes we fail with the nose as well. Okay, it may look as simple to get a foreign body out, but it isn't. Okay, so sometimes we fail, and then we have to make the child more still in another way.
How? In what way?
That is the other way, where we take them to theater, make them sleep, remove the foreign bodies at the comfort of us, the surgeons. So in the end, the foreign body comes out without too much trouble and not too much trauma. Okay.
Yes.
Okay, so that is like under anesthesia.
That's an anesthesia, and that is a foreign body in the nose. So, how about the throat? Okay, some foreign bodies are easily seen within the throat. They may have logged into what we call tonsils. In the part we talked about, the called pharynx, the oropharynx. That's the part of the throat that is behind the tongue. Okay, yeah, and it houses what we call the tonsils.
Yes.
Now, some fish bones, some sharp instruments may just log into that soft tissue, okay? And you can easily see those foreign bodies when you open the mouth. So you still the child and remove the foreign bodies without force, okay? Keeping the child still, removing foreign body. Some may be beyond that point, okay? Whether they are in the airway or in the digestive, or what we call the swallowing part. Okay. Now, if they're in the airway, we still most times, if not all of the times, we require theater. Okay, and because the children have smaller tubes, the adults don't have smaller tubes. They have bigger ones.
Like, you mean smaller airways?
Smaller airways,
Airways,
tubes. Okay, the tubes for air.
That take in air. The
Now,
tubes that
the
take in
adult
air.
ones, you expect less of an occurrence of a foreign body in the airway, because they are big. They can easily cough out those foreign bodies. Okay. In children, they are smaller. When a foreign body goes in, it may block both sides of the lungs, or it may block one side of the lung. So what are you going to do? You make the child sleep under the calmest of situations. The more you arouse this child,
The worse it
the worse it becomes, because then they can cough out, and the foreign body closes both air entries, and then you have a dead body. Okay. So what we do?
You shouldn't have that.
Yes,
But
God
it
forbid,
does
but
happen.
it does happen.
It does happen.
And we've seen it happen. So the idea is, be very calm every time you're handling a child who has a foreign body in the air. So we can go there and pick it expertly. And if it's in the throat where we swallow from, we still use blunt instrumentation and a general sleep or
anesthesia.
for that matter. Yes. And we have the child out. We have rather the foreign body out.
So thank you very much, Dr. Umar and Dr. Angelica, for discussing the issue of foreign bodies within the nose and throat. It's a very sensitive issue because it presents as a medical emergency, so it shouldn't be taken lightly. We have discussed maneuvers you can do if you, for example, someone is choking at home, foreign body is lodged in the nose or in the mouth. You can ask them either to blow one side of the nose and it comes out, or you perform the
Helmish maneuver.
Helmish maneuver. Yes, if these maneuvers fail, rush the patient quickly to the hospital and they'll be taken care of by our specialists, the ENT surgeons. So thank you again, our viewers. You can always follow us on our Twitter handles at the DocTalk Show, or the Facebook page DocTalk Show, or a hashtag, just entering the hashtag NTV DocTalk Show. Thank you very much. We hope you've enjoyed the show.